So this is Ed Crow. Appreciate you joining me today. Today we're going to go over a Medicare sales meeting in call. So more or less trying to give you the basics of what a sales appointment would be like, and kind of the progression of it and how you would talk to people on a call. As I stated before, this is how I did them and do them. This is how I know a lot of other agents do them as well. But certainly other people will have different styles, certainly could be tweaked in different manners. But this will give you a basic idea for those who aren't familiar with Medicare sales, and for those who are, maybe something a little just different than what you do, and you can kind of take the pieces of it you may or may not like. So having said that, I think I'll get us started. Just a couple quick notes for a few new people we had come on in the last minute. We record all our webinars, so if you, for future reference, want to attend one, we run them on Wednesdays and Thursdays. If you want to attend one but you can't make it, just register for it and you will get a copy of the recording. So that way, you can listen to it when you, or watch it when you want at that point. And also, if you have questions, which this presentation probably will generate a few, I would guess. If you have questions, send them into the webinar and I will answer them at the end. So what we're going to talk about today is what you need to have to be prepared to sell, the presentation itself, follow-up process, and then finally a little bit on submitting the application. One other thing I should probably mention is my webinars are usually very short. They're 10 or 15 minutes. This one will probably drag on a little longer than that just because it's a bigger topic. I usually try to split them up, but this one's got a little more to it anyway. So, okay, so what you need to be prepared to sell. So first of all, it probably goes without saying, but you got to be contracted with the most competitive carriers and companies in the area. You don't have to have them all. There's certainly people who do it different ways here. I tended, when I sold and when I sell, I tend to like to have access to most of the carriers so I can fill any niche or be as competitive as humanly possible. So I tended to have all the supplements, the Advantage and the Part D plans. Certainly, like I said, some people don't do that. They'll just have maybe one or two Advantage, a couple of supplements, but it's a matter of preference. But as an independent agent, I always liked having access to everything. But of course, when you do that, that means you've got to do certifications for all the Advantage and Part D plans you have, so that can be a little tedious. The best way I can tell you to narrow down plan choices to figure out what's competitive is to use the quote site. We get a lot of phone calls about what is competitive in a given state or area. And the quickest and easiest way to do that is to use the quote site. Everybody has access to it at no cost. The quote site's on Pinnacle's website. That's pfsinsurance.com. You do need a username and password to use it. If you need a demonstration on how to use it, we have a webinar on that as well. Certainly can send that to you. I would just say to email us or call us at the office and we can send you a recording of that. We're not going to get into that a lot today because it would just it would take too long. But that's a separate webinar we have, a separate topic, and certainly can send that to you. One note to remember is most companies for Advantage and Part D require AHIP. United Healthcare doesn't. United Healthcare is one of the few. If you want to sell their Advantage plans and their Part D plans, they don't require AHIP. You certainly have to do United certification, but you don't have to have AHIP to offer their Advantage and Part D. So for some people, that's nice because they just pick a couple supplements that are competitive and they want to have at least one Advantage plan, so they use United Advantage and Part D so they don't need AHIP. But that's completely up to you. But again, run them on the Pinnacle site. You can quote and compare all the plans, whether you have them or not, and you can see everything that's out there. So we just want to get that out of the way. So first of all, the one of the bigger problems I see when people are working with clients for Medicare plans, or this meaning the agent doesn't understand Medicare A and B and the enrollment process for it. And that's really essential. I mean, you need to understand how A and B benefits work to make this work. So if you don't, we're not going to go through A and B benefits today specifically. I mean, we'll touch on them a little bit, but you really need to understand them because if you think about it, when you're meeting with somebody, they're going on Medicare A and B. So you got to know a little bit about the process to get A and B, and you certainly need to know what A and B covers, what it doesn't cover, to explain to them their options. So I try to give them a general understanding of Medicare A and B, and then based on that, I say, okay, now we're either going to use an Advantage plan or a supplement and drug plan to cover the gaps that A and B don't cover. Along with that is you need to know who's automatically enrolled in Medicare A and B. So, of course, if you meet somebody who is already receiving Social Security payments, they're going to be auto-enrolled in A and B when they turn 65. And it's the first of the month they turn 65. So receiving Social Security payments, it's going to be auto-enrollment. They don't need to do anything. They're automatically going to get A and B. For those who aren't drawing Social Security at the time they turn 65, they can enroll, they can sign up for Medicare A and B online. They won't automatically get it since they're not drawing Social Security, so they should do an online enrollment for that to get Part B, and they can start that online enrollment process actually up to 4 months before the month they turn 65. It definitely takes Social Security a while to get them enrolled, and one of the things that will happen a lot is you'll meet somebody who is 65, let's say, in April, so they're an April 1 effective date, and they don't have their A and B card yet, so they don't know their Medicare number. They'll get a letter in the mail stating what their Medicare number is, but barring that, if they don't think they're going to get their card in time and they're not going to get a letter in the mail in time for you to enroll them for an April 1 start date, you can access their Medicare number on their mysocialsecurity.gov account. I used to say to people, well, I think you can get it on mymedicare.gov, but you can't. To get into your mymedicare.gov account, you need your Medicare number. However, you can register and enroll in your mysocialsecurity.gov account, and your Medicare ID will be in there within about a week of applying. So that's a way they can get it if they don't have their card or the letter yet. Something to be aware of. When they enroll in, when they log into and register for the mysocialsecurity.gov account, they do ask them some pretty tricky financial questions, so just be prepared for that. Once in a while, you will get people who can't answer those questions and can't enroll as a result. I skipped over one of my topics there. I had IRMAA. IRMAA is certainly important, so you're going to talk to them about A and B, let them know if they're going to be auto-enrolled or not. If they're not, I always send them the link to enroll online. You should have that handy. And I also talk about IRMAA. So IRMAA stands for income-related, if I can get it right, income-related monthly adjustment amount. And keep in mind, there's an IRMAA for Part B and an IRMAA for Part D as well. The Part B IRMAA is based on 2 years previous income. So if you're in 2021, it's going to be based on what they made in 2019. And the IRMAA is charged through Part B. So if they're drawing Social Security, the IRMAA penalty is going to be tacked on to their monthly deduction for Part B. If they're not drawing Social Security, they're billed quarterly, and that IRMAA is for Part B is going to be tacked on to their quarterly B bill. IRMAA for D is only billed through a drug plan. So if they have a standalone drug plan and there's an IRMAA, it's going to be tacked on to their drug plan premium. Or if they're taking a zero premium Advantage plan, that IRMAA for Part D will be billed through the Advantage plan. So you just got to be careful it doesn't make a liar out of you. If somebody has IRMAA and you say, well, I'm going to put you in a zero premium plan, and they have IRMAA, it won't be zero. There's going to be the IRMAA penalty charged through that zero premium Advantage plan. So something to be aware of. But to summarize, you got to know your A and B benefits because it's hard to give people advice and make suggestions if you don't. That easily can be searched online for A and B benefits. Got to know the process to sign up for A and B. You should know your IRMAA. And a topic I think I hit a little later in the presentation here is you also got to know the rules for the people who are late B enrollments and people who should take Part B or who are allowed to defer Part B and the rules behind that. That will come up a lot, especially for people who are over age 65, have been working on a work plan and want B later on. That'll be a key topic, so you definitely need to know that. Enrollments can be done through Connect for Medicare or Sunfire. Certainly there's people that are doing face-to-face, which is fine. You can do face-to-face enrollment still on paper apps. But, in today's day and age with COVID and everything, Connect for Medicare and Sunfire have become very popular. We have both, so we provide access at no cost to agents with both platforms. So it's really just a matter of which you prefer to use. If you're contracted with us, you will have access to both. And you can do online enrollments on both systems for Advantage, Part D, and supplements. Clarify for a minute. Connect for Medicare, which is Connecture, will do Advantage, Part D, and supplements. Sunfire will only do Advantage and Part D. So for those not familiar with Connect 4 and Sunfire, you can send scopes electronically through both systems by email or text. The text function is really handy in a lot of scenarios. You can compare plans. You can run medications for them on both. You can save their drug lists as well. So unlike the CMS.gov site where you can't save the drug list unless they've created an account, on Connect for Medicare and Sunfire you can. It'll save all your client and prospects info, and it'll actually save the drug list when you run the drug comparisons for them. Sunfire has a nice additional benefit where if you put a doctor list in, it will save the doctor list. And then if you haven't tried Sunfire before, what's really cool about it is you can save the doctor list, you can run the plans, and it will show each Advantage plan and which doctors on that list are in network or not on each Advantage plan all at the same time. Pretty good time saver. So some people do like Sunfire better because of that. I tend to use Connect for Medicare because I like the ability to enroll in supplements through it as well. And then again, when the person's ready to enroll, you can send them the enrollment link either by email or text. There's multiple options now for doing that. You can basically fill everything out for them and then just email or text them the link to enroll online. Or you can just send them, use your personal URL on either system and let them do all of it if they want. So you have choices when it comes to enrollment. I know in the past, the prospect used to have to fill out information. Some brokers and agents didn't like that. Now you do have the ability to fill everything out for them and just have them enroll in the plan that coordinates with the link you sent them. So they don't really have to enter anything other than to just click and type in their name. And again, Sunfire does not have supplements on their platform. So, of course, you want to be able to be familiar with Connect for Medicare and Sunfire. If you haven't used them, you really should get your username and password. You can call our office for it. Try it out. Do some mock run-throughs on the system just to get familiar with it and use it. But sometimes you'll need application kits as well. I always have a few kits on hand just for people who don't have text, people who don't have email. Once in a while, people like to come into the office or meet face-to-face, so it's always nice to have some kits handy that you can use. I always have them marked up. I put a big X where people sign. If you're talking to people on the phone and they don't want to meet in person, they don't have text or email, you have kits marked up with an X on them. You have a returned envelope. And as the agent, you put on your agent code and your agent name, but you don't sign it. Just wanted to clarify that. You only sign an application when you actually receive it back. So if you're mailing an app to a client, make sure you pre-code it and put your name on it, but you don't sign it until you actually receive it back. Now, if they never send it back to you and just send it direct to the carrier, that's fine. As long as your name and your agent number are on it, you will get credit for the sale. I mentioned on here you can call Amy Cohen at Pinnacle, which you certainly can do, to order kits, or you can just call our office and just let us know what you want to order, and we can put in that order for you as well. But again, always good to have paper apps handy. I do still sometimes mail them out for people when needed, and one way or the other, they get processed. They either send them back to us, or if they send them direct to the company, we've got them coded already, so we're going to get credit regardless. So the actual presentation, the part of the meeting that I'm going to go through, this can either be done on the phone, it can be done in person, or through a screen share. I know a lot of people use Zoom, and there's nothing wrong with Zoom. Some people use Microsoft Meetings. I think that's what it's called for Microsoft. Or some kind of screen share. If you're looking for a free screen share, ScreenLeap is a good option. It does limit you to, I think, 45 minutes, but that's usually enough. So again, if you don't have Zoom or Microsoft Meetings, you can use ScreenLeap. It's just screenleap.com. It costs nothing. You can use the free option, which gives you up to 45 minutes, and it's easy to use. So, you know, I sometimes have done these presentations, by the way, just over the phone without a screen share at all. They kind of work either way, but certainly having a screen share can help too. And what I'll do is at the end, I'll give it a an example of the presentation by showing you the slides that I would use when I go over this with people. Very simple, in fact. I only really used one page for a slide. So what you do is when you meet with a person, when you either meet with them in person or you have a phone conversation with them, you're going to explain to them when and how they need to get Medicare A and B, the things we just discussed earlier, the time frame to get it. So, you're drawing Social Security, no problem. You're going to automatically get A and B. It's going to kick in the first of the month you turn 65. Make sure you mention to them they're going to pay for Part B. The only way they wouldn't is if they had drug help of some kind in your state. That way they wouldn't pay for Part B, but if they don't have drug help, they're going to pay the standard Part B premium. Also got to talk about IRMAA. If they're a high-income earner or if they were a high earner 2 years previously, they might have their Part B payment plus the IRMAA adjustment, so they might pay more. If you meet with people or talking to people who aren't drawing Social Security at the time they're turning 65, they got to enroll online. That's where you have the link handy for the Social Security site where they can enroll in Medicare Part B. Have that handy so you can email it to them if they need to enroll. Regarding delayed Part B enrollment, that's important to know. So if you get somebody who is over the age of 65 or they're turning 65, but they're still going to be actively working and getting coverage through work, they may be able to delay Part B. It might make more sense for them to stay on their work plan. So the rule is with that, the people who can have a valid waiver of Part B must be actively working and getting coverage through work, or they must be getting coverage through an actively working spouse. Be careful there. If somebody says, well, I get coverage through my spouse, he or she retired, I'm going to turn 65, but their company's still offering benefits, they need to get Part B because it's two components. You got to be working or getting it through an actively working spouse and getting coverage. It's the only way you can delay Part B. So what happens in that scenario that we just gave, let's say the person, they're 67 years old, you talk to them, or let's say they're turning 65, you talk to them, and they're no longer actively working, but they're getting their coverage through COBRA or through work. When they turn 65, they need to enroll in Part B because they're not actively working any longer. And if they don't, they're going to miss their special election, their 60-day window to enroll in B. And if they miss that, then down the road, the only other time they can get Part B is through the Part B general election period. And that's from January 1st to March 31st for a Part B effective date of July 1. So you got to be careful that they don't miss their enrollment date for Part B because obviously then they're going to have to wait to get it, and there's really no way around that. So if you get somebody who, I wrote in their employment verification form, that is, let's say you get somebody who's 67, they've been working, getting coverage through work, but now their work coverage is going to end or they're retiring. So they need to get Part B. The way they can get Part B is, since they're 67, they can have a special election for Part B because they either stopped working or lost work coverage or both. To do that, they're going to need their employment verification form. So that is received by the employer. The employer would provide them a form saying, yes, they've been working, getting coverage through work, but now that is going to end, and it has the end date on there, and they will use that form to show Social Security they have a valid election, special election for Part B. And Part B, delayed Part B enrollments now can be done online. It used to be that they had to be done over the phone. You can do them online now. There's a link for them. If you need that link, you can certainly send it to us, or you can certainly call us or email us and we can send it to you. But these are all things that are good to know when you're having a meeting with somebody because you will hit these different scenarios for sure. Okay, so again, you meet with them, you talk to them about enrolling in Part B, sort that out for them, make sure they understand their options. You got to make sure you know what they are, which is important. And then I give them a quick overview of Medicare A and B. And this is where you need to pay attention to your audience. Some people you meet with, they really won't want to know a lot. If they don't want to know A and B benefits and they just want a zero premium plan, you got to kind of work with them on that. I wouldn't force feed them the information if they don't want it. Certainly you want to give them this information, but if they just say, hey, I already know what I want, I don't care about that, I want a zero premium plan, well, then you can skip over these steps a little and move on to talking about the plan benefits and all the things that go along with it. But in general, what I will do is tell them that Medicare Part A is the hospitalization. I'll talk to them about Medicare Part B. And I'll explain that that covers outpatient medical services. And I give them just a quick, simple overview. I usually say to them, you know, A and B is going to cover 80%. If they want a little more detail, I'll explain A is the hospital piece, and it's actually has a deductible. And B is outpatient services. You have an annual deductible and then 20% coinsurance. Or if that seems like too much, I'll just say in general, actuarially, A and B covers 20%. Okay, and I'll say to them, there's no cap on that 20%. There's no cap on your cost share, and there's no drug coverage provided. Keep it simple. You want to keep it in a simple format, and you don't want to overcomplicate it. So you're setting the table for them, letting them know that Medicare A and B covers 80%, that they don't have drug coverage, and they have no cap on their 20% out of pocket. And then you'll say to them, so there's two ways people usually go about handling the other 20% in getting drug coverage. And that's either with a Medicare supplement and a drug plan or with a Medicare Advantage plan. And then I'll get into the two options. So I'll start with, to make it easier, I'll start with the Medicare supp. And I'll say, and again, I don't mean to keep interjecting on myself, but if they know what they want and they really don't want all this explanation, I wouldn't give it to them. But in general, this is what I go over with them. So I start with the supplement and drug plan. So I say to them, keeping in mind Medicare A and B is covering 80%. With a supplement and drug plan, and a lot of times I'll use an example such as AARP. I'll say, well, that's an example of that is AARP is a supplement. I'll say supplements are easy because your Medicare stays primary. So Medicare A and B is an insurance card. That will be your primary insurance. That's what the doctors, the hospitals, that's what they're going to bill. They're going to bill Medicare. Medicare is going to pay their share. And then what is left over is covered by the supplement you purchase. So you got Medicare covering 80%. What's left over is automatically sent to the Medicare supplement we choose, and that's going to cover what's left over with a few exceptions. And usually I will use Plan G or N as examples of this to talk to them about it. So just trying to give them a general understanding how it'll work. And I'll show you later, but I have a picture of a Medicare A and B card I showing them that it's primary and what will be billed, and then what's left over goes to the supplement that's automatically covered, minus any cost share the supplement has. And I'll explain to them then that supplements don't cover drugs, so you'd also need to buy a standalone drug plan. Then I just summarize and say, so on this setup, you've got Medicare A and B, you're paying for Part B. You pay a premium for a supplement. I'll use G or N as an example. And then you buy a standalone drug plan. You've got three components. With that, then because they'll ask if you don't tell them, I'll usually go over what the positives and negatives are of that setup. So positives of doing this setup are there's no network. So as long as that doctor, provider participates with Medicare, you can go. Doesn't matter what state you're in. Doesn't matter whose supplement you have. They don't care. It could be Ed Crow's supplement. It doesn't matter. If they participate with Medicare, it works. So there's no network. You can choose the exact benefits you want, meaning you can do a Plan G, a Plan N. We can determine exactly how much coverage we're going to give you. And then the other thing is there's no managed care on a supplement, or very little. Since the doctors or hospitals or medical providers are billing Medicare, there's not much prior auth. There isn't as much medical management as there would be on an Advantage plan. The negatives of this setup would be the premium. Of course, you're paying 3 premiums as we discussed. You got to buy the drug plan. And this one's gotten a lot more important to people recently in the last couple of years. There's no ancillary benefits such as vision, dental, over-the-counter, transportation. You're not going to get those extra things on a Medicare supplement. But again, I just go over the positives and negatives. So one last thing I'll say about a supplement is I will give an example then and say, so if a supplement costs money every month, you're paying 3 premiums, but if you're a person who wants to go anywhere you feel like, a supplement might work for you, might be a better option. Or if you're utilizing a ton of medical care, a lot of hospital visits, a lot of doctor's visits, might want to go with a supplement versus an Advantage plan. So I try to give them some examples of it just to help them put it in perspective. Then what I'll do is talk about Medicare Advantage. So we've gone over supplement and how it works. Then I'll say Medicare Advantage. Maybe you'll reference Joe Namath and the plans he pitches on TV. And I'll say the first thing you got to know with an Advantage plan is it replaces your original Medicare. So unlike with this supplement, where the doctor or hospital was billing Medicare, when you enroll in an Advantage plan, that becomes your primary insurance. That's what the doctor or hospital are going to bill. And I'll say to them that it's very similar to a group health plan, because often these people you're talking to have been on an employer plan. And you'll say an Advantage plan works in a very similar fashion. The Advantage plan is primary, so it has a network. You pay copays for all the things you do, just like on your work plan. And I'll give some examples. $5 for primary, $35 or $40 for a specialist. Your drug plan is built in, again, just like your work plan. So it's very similar to a group setup. You have copays for everything you do. Drug benefit is built in. The positives of this are you're not going to pay a premium. So I'll remind them, you're still going to pay your Part B premium, because even though Medicare is not primary on this setup, they still take that money. So you'll still pay your Part B premium, but unlike with the supplement, where you got to pay for the supplement and the drug plan, on the Advantage plan, you pay nothing. So, and I always use zero premium plans. You might be using a premium plan, but with my example here, it's using zero plans. So the positive is there's no premium for the plan, and the drug benefit is included. The other positive is it will have a lot of preventative benefits. It'll have maybe vision, dental, preventative and routine vision, dental, OTC, transportation. It might have all those extra benefits that you wouldn't get on original Medicare and a supplement. Also talk about the negatives of an Advantage plan. With an Advantage plan, you have copays, out-of-pocket max, managed care, and network. So even though it's a PPO, you pay a lot less if you stay network versus in-network versus going out. You've got copays for everything. Those copays could add up to the out-of-pocket max of the plan. And you've got the managed care element. So prior authorization for scans, prior authorization for a number of procedures that you might not have to get on original Medicare. So that would be a disadvantage of the Advantage plan. And again, I'll mention the network as well and the out-of-pocket max. So then I'll give an example of somebody who might take an Advantage plan versus somebody who might take a supplement. And I'll ask them some questions about their basic health to help determine. And I know the rules say you can't ask health questions. Well, you don't need to be specific. I'll just say in general, how often do you utilize medical care? I'm not asking them about specific health conditions. I just want to get a feel for how often they go to the doctor and receive medical care, because that will help me make it a suggestion to them of what plan might work out better for them. So some examples of that might be somebody says, Ed, I go to the doctor twice a year. I really don't do much. An Advantage plan might work well for them because they're not utilizing a lot of care. Versus if I get somebody who says, Ed, I go to the doctor 3 times a month and I was hospitalized 4 times last year. That tells you that person will probably hit the out-of-pocket max on their Advantage plan, and they probably utilize a lot of different doctors. You might be better off with a supplement for them. When you frame this way, though, they will usually tell you what they think. And that's the whole goal here, is just to get them to sell themselves and make that decision for you. Hey, based on what you're saying, I think a supplement's better. Or based on what you're saying, I think an Advantage is a better fit for me. Always better to have buy-in from somebody and have them make that determination versus you making it. You're just leading them down the path to help them decide what's better. Once we do that, we'll usually get a feel for what kind of plan they want. Then I'll talk to them about when they can enroll and make plan changes. So this one's a little all over the board depending on where you are. If you're in a guaranteed issue state, the rules are different versus if you're in a non-guaranteed issue state. So I'll explain to them the AEP and how they can change every year using AEP. I'll explain how the OEP works, and we all should remember that OEP, you can change, from January 1 to March 31st. During OEP, you can make a change from Advantage to Advantage, or a change from Advantage to an original Medicare supplement and drug plan. Can't go the other way, though. Can't go from supplement to Advantage. So I'll just explain that. If I'm in a guaranteed issue state, the 4 guaranteed issue states are New York, Connecticut, Massachusetts, and Maine. They can utilize these periods. It never can be blocked going from Advantage to supplement. However, if you're in any of the other states which are not guaranteed issue, at some point, if they try to make that change from Advantage to supplement, if their health is failing and they got health conditions, they might not be able to make that move because they're subject to underwriting. I went quick with that, but that's usually important when I'm talking to clients to help or prospects to help them understand what their options will be when it comes to that. Then what I'll do is explain to them how I operate. And this is something I used to always forget to do, and I realized that people don't really know. So it's important to explain to them how you do business. You'd say to them, I don't charge a fee for this meeting. The rates that you're getting are the same with or without me involved. And I used to say to people, I'm kind of like a auto and home agent where I can look at multiple companies. I can shop for you to find the best plan for your situation, and your rates are the same whether you use me or not. I don't charge a fee because the insurance companies pay me commission. So I'm paid a commission. You pay the same rates regardless. And my whole job is to help you find the best fit for you based on the number of carriers that I offer every year. The reason I brought that up is I used to often get people at the end of the meeting would say, well, what do we owe you? And I would realize that I hadn't explained to them how it all works, which I think is important. Once you get to that stage, then you'd explain to them how they will enroll. You could either do it online through Connect for Medicare or Sunfire. If not, you can email them an app. I used to email a lot of applications. Some people don't like doing online enrollment. Most do, but some don't. And if they didn't, I'd ask, well, do you have a printer at home? If you do, I'll email you an app. You'd be surprised how many people preferred just to print the app, fill it out, and then scan or email it back. If none of that works, then you can let them know that, you can mail them an application with a addressed envelope, return envelope. They will fill it out and send it back. One thing I always made sure to mention to people is let them know if they make mistakes on the app that you will help them with it. You won't send it in wrong. You'll review it with them once you get it. People worry about that, and that's something we might not think about. You also want to make them aware of the fact that prior to AEP, you'll give them a call to talk to them about their options for upcoming, for January. Maybe there's a better plan that came out. Maybe there's some major changes to their plan. But one way or the other, you'll give them a call. If you're not calling your existing book at least once prior to AEP, in my opinion, that's a mistake. I think you're going to lose more clients than you would otherwise, and I definitely think at least a call should be made out to them. My entire book, we would call them at least a couple times prior to AEP just to make them aware of the fact that this is the time they can review plans if they'd like. Okay, so if you're using a screen share or meeting face-to-face, I strongly recommend a visual aid. I'm going to show you the one I use. I always use the same one. I used it actually right out of the United Healthcare Medicare and U book. And I also had IRMAA forms, too, that I would go over with them. For my visual aid, this is what I would use, and it goes right along with what I was talking about. We talk about Medicare A and B, and there you can see the A and B benefits, the Medicare card. I explain how those works, and then how they work, and then I would go into my options. So I'll leave original Medicare primary, buy a supplement, and get a standalone drug plan, option 1, and all the details I talked about earlier with that. And I would use this visual aid as I was explaining that to them. And then I would say, or if you want to go with the Joe Namath type plan, 0 premium, I would then explain option 2 as opposed to 1. Here's your other option. I'd explain the pros and cons of an Advantage plan and how it works, and just making it very clear that the Advantage plan is primary, so your doctors and hospitals aren't billing Medicare when you go on an Advantage plan. And of course, I talked to them about all the extra benefits and things they can get. I worked right off this one page doing my explanation because it made it very simple, and I found that in most cases they could follow what I was talking about. Of course, then I'd have the IRMAA grid. This is the current one, so it's showing, income for individual or joint tax return, shows what you pay for IRMAA in 2021 based on your income in 2019. So you can see somebody who's making an individual or somebody filing individual making less than $88,000 or a joint couple making less than $176. You can see they pay $148.50 for the standard Part B premium, and then based on their income, obviously Part B goes up substantially based on what they made in 2019. This is adjusted every year, but it's always 2 years behind. And then I had the Part D IRMAA because that's easy to forget about. But believe me, if somebody has an IRMAA and you talk to them about B and didn't mention the D, they will get upset about it. So I would have both. and go over it. Now, if the people have talked to me and said, hey, our income's, we make $40,000 a year, well, I don't bother with this then. But in general, if I think their income is going to be in a range where they're going to have an IRMAA, then I certainly would go over both of those with them. All right, a couple final thoughts on this. Again, if you're using paper apps, leaving paper apps with somebody, mailing paper apps to somebody, emailing and scanning paper apps, so you're not using Connect for Medicare or online enrollment, put your agent name and your agent number on the apps. Don't sign them. Just make sure you do that. If you get a paper app, you can send it to Pinnacle. Pinnacle will process all the company's apps for you. What's nice is then you can have one place where you can follow up on applications being sent in, as opposed to calling all the different carriers. If you want to know where to send those, you'd go to Pinnacle's website, www.pfsinsurance.com, click on the Services tab, and then New Business. A couple other quick things. Always get a scope. I get that question all the time. Hey, do I need a scope of appointment for this or that? Just always get one. It's the best way I can put it. If you're talking Medicare of any kind with somebody and your intent was to make a sale or enroll them in a plan, get a scope. Even if you don't sell them, get a scope. I think you should just keep it that simple. If in doubt, get a scope. You're always better off having one than not. It's an easy explanation. You just say to them, this is a form and you need you to sign. I don't send it in with the application. It's just a form documenting what we're talking about today. That's all you got to say. I don't think I've ever had somebody balk at filling a scope out. Keep in mind how popular ancillary products are now. Things have changed a lot in the last 4 or 5 years. In the past, people concentrated on medical benefits. Now it's crazy. It almost seems like they care more about dental, vision, OTC, transportation, personal emergency response systems than even the benefits. I have had many situations where somebody is literally enrolling in a plan just for the dental or vision, which probably doesn't make sense. I try to give them a little advice there, but I don't push back too hard. I mean, I've found that if you push really hard and say, listen, you can't take a plan just based on dental or vision, you can mention it. But if you ultimately don't let them make that decision, they're just going to be upset with you down the road. That's what I find. So certainly you want to advise them. But if they're really fixated on one of those ancillary benefits, you can mention to them your thoughts on it. But again, I wouldn't push back. They're the customer. Your job's to educate them. But ultimately, it's up to them what decisions they make. But I think those who haven't been doing this much yet, you'll be shocked how what a strong attraction those benefits are to people now. I think it's because of all the commercials, quite honestly. This one sounds simple, but remember to listen to what people want. I've done a lot of ride-alongs with people. A lot of times, people are just in the mode of just telling them, talking at the client, telling them the prospect, just telling them what they think they need. It's important to listen to what they want. And yeah, it's your job to give them advice, show them their options. But at the end of the day, you got to listen to what's important to them and do what they want at the end of the day. And then lastly, I'd say keep it simple. The less complicated this is, the better. And adjust to your prospect. If you got a really detailed person, they want all the details, great, give them all the details. If you got somebody who's getting glassy-eyed and they're like, I just want to know what plan's best for me, well, adjust your presentation. I mean, if they just want an Advantage plan, you might want to briefly mention, what a supplement is. You might not. You might want to just go over the positives and negatives of an Advantage plan. You want them to be aware, but you definitely got to adjust the presentation based on your audience. That's it. That was pretty quick for a lot of information. I know I went by that fairly quickly. This strategy certainly works. It works very well to place a client or a prospect in the plan that fits them. At the end of the day, then when you talk to them on the phone, if they say, hey, I don't like this Advantage plan, say, well, we did go over the positives and negatives. We talked about a supplement. You covered all your bases. So I think that's important. The strategy will work, but it's important that you understand the details in order to do it. You really need to know all the things we talked about. I will send a recording of this webinar out. I'm going to take a look and see if we have any questions. If you want to get contracted, you could send, email Lisa at CroneAssociates.com or just call us. If you have questions, call us. I'll be happy to talk to you about anything. I know I personally and Lisa and Teal all talk to agents all day, so we're happy to answer any questions you might have. See if there's any questions. Okay, can you explain how the Part B deductible plays into MA and Med Sup? Sure. So the annual Part B deductible is set every year by Medicare. It's a very astute question, by the way. The annual Part B deductible is adjusted every year by Medicare. Right now, the annual Part B deductible is $203 a year. It's not applicable really on an Advantage plan, because an Advantage plan is simply going to have copays for everything you do. So the Part B deductible is kind of baked into the Advantage plan. So you'll just pay whatever your copay is. You don't pay the deductible first when you have an Advantage plan. However, on a supplement, a Plan G and N supplement, every January, they're going to have that Part B deductible first. So you might say to them, everything's covered on a Plan G. Well, except Plan G doesn't cover the Part B deductible. So when that new year starts, you might get a call from your client saying, hey, I just went to the doctor, I had to pay $90. That's because they're meeting their Part B deductible on Plan G. One other really kind of detailed thing with this I'll mention is, let's say somebody had an Advantage plan for 6 months of the year and then you moved them to a supplement, or maybe you moved them during the OEP. If they've already met their Part B deductible through the Advantage plan, meaning they enrolled in the Advantage, they paid some copays, when they then move to the supplement, they won't have the Part B deductible. It will already have been met. Same thing if you have somebody on a Plan G, let's say, and then maybe halfway through the year you move them to an N. They only meet that Part B deductible in the supplement once. Good question, by the way. So question is, did you say that Pinnacle would be able to find the best fit plan for our clients? No, not necessarily. What I was saying is we can help you do that, or really the easiest way to find what's competitive is to use Pinnacle's quote site, which you have access to. So you can go to their quote site with the username and password, and you can easily compare Advantage plans to see and line them up and see what has the best benefits in that area for the given client. Or, you know, if you do that and it still isn't very clear to you, you certainly could call us up. I mean, Pinnacle would help you with that too. But I think what they're going to say is we'll go on the quote site and compare and look at the plans. But then we can say, well, the most common plans that sell in this area are this one and this one. But I think the quote site is the best way to see those details. All right, do we have any other questions? It looks like we don't. So I think I will wrap up here then. Well, thanks for attending today. I appreciate it. A recording will be sent out. If you have any questions, please give us a call. And I hope everybody has a great day. Thanks for coming on.